what we shall call it, whether it is agonist or antagonist, and many have given. I hope very good. So then many answers came antagonist, etc., etc. Okay. So one thing, almost just like what you learn tables in or alphabets in your earlier classes. Similarly, whenever you sleep or somebody asks you in the midnight about agonist, immediately you should that anything, any chemical which is having affinity and intrinsic activity is agonist. So what is antagonist? Anything which is having only affinity and no intrinsic activity. What if any drug is acting on a receptor and causing inhibitory type of action? Then you should ask, tell me clearly whether it is acting through receptor mechanism, it is initiating any kind of intracellular mechanism, just like we have seen second messenger, etc. If yes, if it is doing that, means it has got intrinsic activity. If it has got intrinsic activity, that means it is agonist. So whether it has got stimulatory activity or inhibitory activity, it is not our problem. This very basic concept is clear, very simple concept. But students get confused, and because of this confusion, they make a lot of mistakes throughout their life. Okay, so once you understand what is agonist, what is antagonist, then you start classifying them what they are. First, agonist should classify as agonist, antagonist should classify as antagonist. I hope this much is very clear. If this concept is clear, then your most of things are clear. Your other things are they are getting easier for you. Now, next time onwards, what you will do? So far, I have not asked you to read pharmacology simultaneously or before I teach. Now, henceforth, you can read the topics. Example, ANS, you read it in anatomy physiology. Read it well. Once you read it well, then apply all these pharmacodynamic concepts. These are not very big. After applying concepts, read pharmacology book. Okay, and read it thoroughly. Once you read it thoroughly, then you will understand the concept, because each and every line we cannot teach. It is very big. Pharmacology is a big science. So we cannot teach each and every line. What you can do is, once you are reading it simultaneously, during class itself you can ask, "Okay, these are the difficulties. If it is in the flow, we can immediately resolve it. If it is not, we can have a session just like we had earlier." So mind well, if this pattern you will apply, and you will be the first batch in the history in PharmD who is doing in this kind of pattern. If you do this pattern, it should work wonders for you. Okay, so try your best. Those who genuinely want to be good with pharmacology and therapeutics, can they have the best way to do is this. Now let us go for ANS. You know about ANS, what it is. You told earlier. So it has motor neurons. It is innervating the smooth and cardiac muscles. Then and it's acting through various. It operates through subconscious control. Everything we discussed that day. Okay. Then we also call it as the involuntary nervous system or general visceral motor system. So if we classify it from CNS, or CNS is always in touch with peripheral nervous system, because major centers are controlling. Anyway, we have seen, if you remember the control mechanisms of ANS, we have seen that neurohumoral controls, regulations. I was asking everything so that if I brush down so fast, it should not happen that you are not understanding now, because you have read it in anatomy physiology. I have given you enough time. So during regulation, so CNS plays important role in all these regulations, including neurohumoral regulations and feedback controls. In both way, CNS is important. Therefore, we are having arrows. So peripheral is having components, sensory afferent component. We know about sensory. We know about motor. Okay. In motor component, we have two. divisions: somatic division and autonomous division. In autonomic division, we have got two branches, that is sympathetic and parasympathetic. This is what our classification particularly related to peripheral nervous system. Okay. These all things are very, very important. In what sense? Whenever we go one by another, example, whenever you go for pain, then sensory afferent division will be, because it is carrying pain sensation. When we are working for skeletal muscle, then somatic system is important. And when we are working for all other visceral organs, ANS is important. So anything, any drug which is acting on cardiovascular system, particularly in most of the cases, except it is having direct action, in most of the cases, either it is acting through sympathetic or parasympathetic. If it is acting on GIT, it is acting on any other smooth muscle. So we must be aware that if we are good in this system, we are good in most of the other systemic pharmacology, may it be cardiovascular, may it be GIT, may it be uterine mechanism, whatsoever it may be. So this is very, very important, and therefore I repeat that you are very fortunate that before therapeutics this is happening. You are fortunate, you are getting time, and if you do not utilize it in a proper way, you will curse yourself for a long period of time. Okay. So we have seen it. Two systems differ in their effectors, their efferent pathways, their neurotransmitters, target organs. This you have seen in physiology also. So effectors, example, somatic, I just now told it acts only skeletal muscle. So anything, any drug which is acting on skeletal muscle is having either direct or indirect some impact through this mechanism. ANS, cardiac, smooth gland, etc. So any drug has to act, or any system we have to study for this. Definitely ANS is involved. What are the different pathways? There are various kind of neurons. So A are thick neurons which are heavily myelinated. They are somatic motor fibers, and they are, myelinated are having very high speed. Non-myelinated are having slow speed. So there are different kind of this somatic nerve efferent pathways will be important when you see. I told you about pain. For pain, it will be important. So whenever we'll go for pain, before that, I'll expect you read these various type of neurons, their conduction velocities, and how they are doing. You know about myelinated, non-myelinated. ANS pathways are having, again, there is a two neuron chain. There are preganglionic neuron. Anyway, what is ganglion? What is ganglion? See, dear friends, please give some time if you are not very sure. It is not a KBC that it is the fastest finger that you should immediately respond. Okay? Give some time, try to think. Bunch of nerve fibers. In central nervous system, in brain there are bunch of nerve fibers, Anirudh. Yes or no? Collection of neural cell bodies in the NS, okay, group of. Yes, my same question is there, either bunch of neuron fibers or Aditya informing that group of neuron cell bodies. Suppose it is a thalamus, so, or hypothalamus. Is not it a group of cell bodies, or cerebrum is not the group of neuron cell bodies? Anyway, your answers are, you mix it together, you answer, then it will get a correct answer. It is a either bunch of nerve fiber you call or group of, yes, group of neuron cell bodies in the peripheral nervous system, or it is also simply called as it, whatsoever group of cell bodies which are present outside the CNS. So CNS involves what? Brain, cerebellum. Okay, brain means up to medulla oblongata, and then spinal cord. Up to that, everything is the CNS. Okay. After CNS, after CNS, whatsoever cell bodies are there, these all are called as a ganglions. It is important. So both are having variety of neurotransmitters. These are very very important, because now here your pharmacology starts, because we know what are neurotransmitters. Neurotransmitters are the ligands. You know about ligands. So ligands, they have some specific receptors in the body at any place, and these ligands bind these particular receptors, and because of that they acts as a messenger, because somebody gives first message, then they may or may not cause a formation of second messenger, whatsoever mechanism they may have. If it is a direct cell membrane transporter modification, then it will not cause second messenger, but this messenger will cause alteration in cellular function to what you called as a physiological effect. Okay. So here all these somatic motor neurons, they will release acetylcholine as AC, which we normally call as a ACH. The short form is very popularly used, or very acceptable use is there. And on that, effects are always stimulatory whenever it is there. ANS, the all preganglionic fibers, they will release ACH, so they will ACH will act on ganglion. Postganglionic fibers will release either norepinephrine or acetylcholine at the effectors, and the effect is either stimulatory or inhibitory depending on the type of receptors. So this we have discussed earlier. Okay, that it is there and there, but both are agonists. That was my last time question, whether it is agonist or antagonist. So whatsoever it may be, both are agonists. Only the what we call it as a signal transduction mechanism is different. Therefore, the actions are different. So this is how the picture is there about various types there. Somatic is there. In somatic, you will see that there is a no ganglion is present. Okay, from CNS it is directly connected, and uh, okay, you know, just a minute. Hmm? 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 So from this you can see that. Hmm? Can you see something? So I am okay. Very good. So you can see that ACH is there. Okay, that is a direct synapse, and you can see heavily myelinated fibers are there. That is somatic. So from there in CNS, the cell bodies is CNS. From that it is there, it releases ACH. Effector organ is muscle. Effect is stimulatory. Then sympathetic system we see. See, the cell bodies are there. First type of cell bodies all are there in CNS. Okay, either it is thoracolumbar or craniosacral. In parasympathetic, we know it is a craniosacral, it is thoracolumbar. So now it is going, this is releasing acetylcholine everywhere. In all cases of ganglion, always it is acetylcholine, whether it is sympathetic whether it is parasympathetic. These are the preganglionic fibers releasing acetylcholine, preganglionic releasing acetylcholine, preganglionic releasing acetylcholine. It is acting on ganglion, this is acting on ganglia, this is acting on ganglia, everywhere it is acting on ganglia. And these ganglia, see, this is a ganglia. The cell bodies are where? They are outside the CNS. So these are the outside the CNS. This is a unique case. This is an exceptional case, that is adrenal medulla, where adrenal medulla itself behaves as a ganglia. Okay, it's not a group of cell bodies. It is a gland. So in that behaves as, it is not a ganglia. Otherwise we would have called it as a ganglia. So this is acting here, and because of this adrenal medulla, because of this particular thing, it is causing release of adrenaline, noradrenaline. This is important. This is playing here. Epinephrine, norepinephrine, they are not acting, not only acting as a neurotransmitter, but also acting as a hormones and playing role in fight and flight mechanism, which you started earlier, you discusses. So here the neurotransmitter in sympathetic is noradrenaline, in parasympathetic it is acetylcholine. These are the target organs. We shall see these target organs one by one. So this is what basic concept we should understand. We should understand what are the neurotransmitters. Now neurotransmitter you can remember, but at the same time you can remember that we call them as the ligands. And being the ligands, since they are the biogenic chemicals, they all are the agonist. Okay, if they are, if anything from outside would have been added, then we would have called it as a antagonist. Okay, so what are the divisions? Sympathetic, parasympathetic. We know that they are served by both. What is the role of parasympathetic? You have seen some of you inform, discuss also, the answered also. So it promotes maintenance of activities, it conserves body and energy. Its activity is illustrated in patients who relaxes, reading after meal, blood pressure, heart rate, respiratory rates are low, GI tract activity is high, pupils are constricted and lenses are accommodated for close vision. Sympathetic, it mobiles body during activity. We call it as a fight and flight. Promote adjustment during exercise. When creatine blood flow is centered to skeletal muscles and heart, bronchioles they dilate, liver releases glucose. So we have seen these differences also, thoracolumbar and craniosacral. We have seen these anatomical differences. You have seen it earlier also. These are the places where they are supplying. I expect you that you have studied it in anatomic physiology. If not, please go through it again. These are the parts where it acts. You might have seen there are ganglionic chains and everything. I repeat, please read that pharmacology, physiology well. Okay. Now these are the places where the drugs are acting. And once we understand, this is why therefore we call it as a dual innervation. Dual innervation means, example, eye is supplied with parasympathetic also, sympathetic also. Okay, lungs are supplied with parasympathetic or acetylcholine receptor also, sympathetic receptor also. So like that, all these or most of the tissues are having both type of uh, systems, sympathetic and parasympathetic. They are balancing each other. That is what homeostatic balance they are trying to maintain. And therefore when one activity is required more, or by chance one goes faster, just like if you are very fast and by the time somebody by the time you put brake, uh, the uh, the vehicle still go ahead for some distance. So if it goes by some distance, okay, to avoid problem, another thing is there, some pulling mechanism is there, so that another neurotransmitter is acting as a pulling mechanism. Okay, this is to avoid over activation of one or other, like that. And when this goes wrong, when it doesn't follow it properly, or because of either genetic, physiological, environmental, or occupational factors, if these things goes wrong, the people they encounter diseases. So how these are happening? Okay, craniosacral means, always you remember, it is a parasympathetic. Sacral means it is what? Yes, cranial and sacral, both are parasympathetic. Cranial means they are coming from brain. So therefore we call it as a cranial. So these are various nerves. We call them as a cranial nerves. How many cranial nerves you have seen? Very good. Very good. Very good. Okay, okay, fine. So out of that, see, these are the cranial nerves. They are actually parasympathetic nerves. Which are these? Oculomotor, facial, glossopharyngeal, vagus. Okay. Now, how they do their job, where they act, this everything you have studied in physiology. Okay. Then sacral outflow is there, S2, S4, and it acts on large intestine, urinary bladder, ureters, and reproductive organs. We shall see activities later. Now, what we have to understand in ANS is first thing is one is what is the innervation. Innervation means which nerves are supplied to that particular organ. That is, we call it as the innervation. Okay, so we know that there is a dual innervation. Means that most of the organs are supplied with sympathetic also, parasympathetic also. That means all these organs are having receptors for noradrenaline also or norepinephrine. Same word, norepinephrine, noradrenaline. They are one and same. So noradrenaline also there are receptors for acetylcholine also. Okay, the receptor may be present on the same tissue or maybe different tissue or same type of uh, smooth muscle or slightly different type of smooth muscle. So these are all these activity we should understand now, and accordingly we'll understand. Then once we understand, if it is understood to us, if we try to remember, then if somebody asks you in the night that what happens if acetylcholine is increase in the eye, immediately will speak meiosis. Why meiosis? Because there are muscles which are called as circular muscle. It is having receptor only on circular muscle. Because of circular muscle, they will be constrict. Because of that, pupil size will decrease. Simple. So that simple it is. Means nobody needs to mug, because what I know is I know that there is a parasympathetic innervation, and that innervation is there, and what place that is, it is there in the circular muscles. So circular muscles will constrict because of pupil size will come down to what we call as a meiosis. Now suppose somebody asks you this question for examination, how easy? Only thing is you should understand how to elaborate it. Okay. If somebody asks you for 5 marks, write the impact of sympathetic system on eye. Write the impact of ANS on the eye. So you can write about it. You know what is parasympathetic. You know about sympathetic. So whatsoever effect are there, you have just try to remember only two facts. And because of these two facts, if you, when you are correlating with that, it become easy for you to just to explain because points were known to you. People make mistake in pharmacology is they try to mug, and once they try to mug, then it is beyond anybody's capacity, uh, even beyond my best teacher's capacity to mug each and everything. So here you have to go for common sense, you have to go for application of mind, and if you do not do it, if you do not refresh it, then it will be a problem. So I hope you are getting it clear. Day by day, you need to be more and more active. You need to be more and more prepared for this. So these are various organs and various ganglions which are there, which are playing role into it. Okay. So that will help you to understand. Again, it is a physiology. It is not a pharmacology. But you should understand what are the places which are innervated and how they are going. This is the craniosacral pathway. Okay, sympathetic is another division, that is we call it as thoracolumbar. It uh, produces the lateral horn from the spinal cord. Preganglionic fibers pass through the white rami, communicates and enters sympathetic trunk, that is paravertebral ganglia. These are very very important. If you go back again, you read either in Totora or Guyton good book. These are paravertebral ganglia, they are almost running parallelly. It's almost side of, necklace we have. So it's sort of this necklace like a diamond or pearl necklace is there, है ना? हीरो मोती की माला होती है वैसे it is all around the spinal cord. These ganglions are there. So each pearl is just like one ganglia, and because of that, it is very widespread and they are interconnected. You will understand the reason. It is given nicely in Totora that uh, they are interconnected. The cholinergic, they are very far away. They are not that interconnected, but that much interconnected. The upper portion and lower portion are at least some separated. That is cranial and sacral. But here, most of these are interconnected, and therefore, if one is impacted, other can also impact it. Okay, therefore, the impact is very widespread, multiple times. You read it again from physiology. So these are various ganglions which are there. You just read this topic well from physiology. So how they are acting, this is again I will not cover. Sympathetic trunks and pathways are there. How the synapses are formed and how their ascending descending synapsing trunks are there. So this is very important as I told you, because it is important for multiplication or one type of activity is going in other type of organ. The reason is giving. This is what explanation for that. Okay. So next in that, these are the figures of sympathetic innervation figures. Then next are this is all anatomy physiology. I repeat. So this is chain ganglia. I told you it is a chain-like thing or it is a necklace-like thing. Already I told you. So they innervate sweat glands, erector pili muscles, vascular smooth muscles. So these are chain ganglions are formed. There are pathways towards the head. Pathway emerge from T1 to T4 are synapsing in the superior cervical ganglia. They innervate skin and blood vessel of the head. They stimulate the electro muscles of the iris, and they inhibit nasal and salivary glands. So once you understand that this pathway causes inhibition of nasal glands, salivary glands. So once you know about nasal gland, then immediately you have got a medication for common cold where there is a running nose. Okay, this is how pharmacology works. This is physiology, that it inhibits nasal secretion. What? Adrenaline or sympathetic mechanism. Sympathetic means adrenaline. Sympathetic effect causes inhibition of what? Sympathetic causes inhibition of nasal secretion. So that means any drug which is doing similar action of sympathetic will decrease sympathetic nasal secretion. That means if there is increase in the nasal secretion, when there is increased secretion in common course. So in common course there is increase in, or we call it as a rhinitis, we call it as a runny nose, whatsoever. So in that, if we have got this, that means this drug can work. Okay, this has got simple pharmacology. So this is how pharmacology works. There are pathways to the thorax. There are preganglionic fibers. They are emerging from T1 to T6. They synapse in the cervical trunk ganglia, and postganglionic fibers which are emerging from the middle and inferior cervical ganglia. They are entering the nerves from C4 to C8. They are innervating heart via the cardiac plexus. What is plexus? What is plexus? Very good. It is network. Either it can be of blood vessel, so it, or it can be of nerves. So there are plexuses, cervical. So cardiac plexus is there. The Nivedita is not always blood vessels. Here it is the cardiac plexus means it is the neurons. So as Ruchar told, it is simply network. Okay. So either it can be network of neurons or it can be network of blood vessels. Any network is simply plexus. Then most fibers from T5 to L2, they synapse in collateral ganglia, they form thoracic, lumbar and sacral splanchnic nerves. Their ganglia includes the celiac and the superior inferior mesenteric ganglia. Then there are pathways to abdomen. So all these pathways, they are actually physiology. I repeat, please go through this physiology and try to understand from that. And every time you try to get some idea that in such case what will happen. Okay. So here in pelvis, that is sacral like splenic nerves, then mesenteric and hypogastria ganglia, reproductive organ, urinary bladder, etc., large intestine. So everywhere they will show action. Synapse in adrenal medulla. This is I told you it, here it is acting as a hormone because when it is there, medullary cell will secrete norepinephrine and epinephrine into blood, and here they will act as a hormone. It will act as an endocrine, and wherever the receptors are there, they will show same action as the neurotransmitter it is. Okay, and therefore, when fight and flight mechanism is there at that time, this adrenal gland is stimulated to secrete more and more such thing, and therefore very profound effects are seen. So visceral reflex arc, you know, what is reflex arc? Okay, but it is not just response. साल भर के बाद रिस्पांस आया तो चलेगा. Okay? It is immediate response to any, yes, and it is simplest, yes, okay, fine. Okay, so similarly they are same, just like there are motor reflexes you have studied or reflex arcs, similarly they are same. The difference is visceral arc has two neurons in a motor pathway, uh, while in somatic only single neuron is there. Okay, visceral pain afferents travel along the same pathway as somatic pain fibers, contributing the phenomena of referred pain. What is referred pain? Anybody knows? Have you ever heard? Okay, search it, then we'll discuss. Okay, tomorrow, even if I forget, somebody should start it. What is referred pain? Okay, so this is how the reflexes they are working. I'll skipping this slide. Okay, so these are the things. So now here actually pharmacology starts. Here, that is cholinergic fibers, they release neurotransmitter acetylcholine. All ANS preganglionic axons. Now, which are these? Now, from now onwards, we are forgetting the term ANS. है ना। अभी तक अपन ने एएनएस एएनएस बोला, अभी एएनएस नहीं है हमारे पास now what's the thing we have is the neurons which releases acetylcholine, or because of that the effectors in the nearby are there for the having acetylcholine receptors. So these neurons which are releasing acetylcholine on the nearby effectors, will call them as a cholinergic, and those which are the neurons which are releasing noradrenaline, which is acting on the adrenergic receptors, that is which are for adrenaline, noradrenaline, to this type of receptor will call as a adrenergic. Now understood? Now we are keeping ANS as a base. Now on that we have made one bigger higher step. Okay. Now we have got what kind of systems now? How many types of system we have got? Yes. No answers? How? This much time you take? Name these two systems fast. Too long you are taking for answer. Yes. Sabah. Nivedita, just now what I told. We are forgetting ANS is one thing. So definitely we are forgetting somatic also, because we are going on the next floor now. This was our base floor. Now our next floor is what? Just now what I explained. We are also forgetting sympathetic, parasympathetic now. Yes, cholinergic and adrenergic. What do you mean by cholinergic? What do you mean by cholinergic? Exactly what? Adrenaline or ACH? Okay. So what type of system we have got? One is cholinergic, one is adrenergic. If we have to name sympathetic, what will name it? If, if we have to give name to the sympathetic system, what name will give to sympathetic? We'll call it cholinergic. isn't it? Why we call it as a cholinergic? So Sapa, you say that it releases adrenaline, so we'll call it as a cholinergic. Rucha says that it releases ACH, if I have to name. So I will call sympathetic as a cholinergic, isn't it? Hmm? I'll call. What is final? So sympathetic can be called as what? Parasympathetic can be called as a what? Okay, it's clear. Have you ever heard the word mimicry? Mimicry? नहीं सुना मिमिक्री? क्या होता है मिमिक्री? What is mimicry? Acting like that. Very good. Very good. Copy someone's actions, accent. Very good. Very good. Very good. Copy. So any other chemical which is not adrenaline but doing same thing as adrenaline is doing. Mhm. Can we call it as a adrenomimetic? It is not adrenaline, but if it is administered into the body, it can show similar action. Yes, Got my question or not? There is a chemical, suppose I know one chemical which is called as isoprenylene. Okay, this isoprenylene is not adrenaline, it is not noradrenaline, but it can cause same actions as the adrenaline can. जो adrenaline की action होती है वही ये isoprenylene कर सकता है. Can we call it as a mimicry of adrenaline? बोल सकते, मिमिक्री कर रहा है ना. So all the drugs which copy or which do this is in English called as a mimics. Copying means, so which mimics the action of adrenaline, we call them as a adrenomimetic, है ना. अगर जो ड्रग एड्रेनोमाइमेटिक है उसको और क्या बोल सकते हैं, व्हाट यू कैन कॉल इट, वी कैन कॉल इट सिंपैथोमाइमेटिक, क्योंकि वी हैव सीन दैट sympathetic is adrenergic, isn't it? So adrenomimetic is a sympathomimetic. Understood? वैसे एसिटाइल कोलिन के बारे में क्या होगा, एसिटाइल कोलिन के बारे में, which type of drugs we can have? What we'll call them? Parasympathomimetics and or cholinomimetics. Okay, so that means parasympathomimetics and cholinomimetics are same, or the adrenomimetics and sympathomimetics are same. ठीक है. सिमिलरली बायोकेमिस्ट्री में पढ़ा था कभी, एंजाइम या सेल पढ़ा था. What do you mean by lysis? Very good. The agent which causes breaking, what we call it as a, we call it as a lytic. Okay, very good. So what do you mean by adrenolytic or cholinolytic? रिसेप्टर को ब्रेक करना जरूरी है समस्या उसके लिए, इज इट नेसेसरी? Simply what you want is stop the action, is a breaking. Okay, who will stop the action? Who will stop the action? Inhibitors. What you call them? What you call them? Which are the agents? Very good. So these are the antagonists which will, these are all antagonists or blockers. So antagonists, blockers, these are the synonymous terms. Antagonists, blockers are there. Okay. What they will cause? They will stop the action of agonists, because agonists are present in the body. You are giving the drug from outside. Okay. So these are the drugs, they will block the action. So we call them as a anti-adrenergic, anticholinergic, or cholinolytic, adrenolytic, sympatholytic और पैरासिम्पैथोलाइटिक. ठीक है. अगर किसी ने सवाल पूछा तो पैरासिम्पैथोलाइटिक, तो ऐसा नहीं होना चाहिए nobody has taught us. ठीक है. All these terms are same. This much you have understood. Basic concept is clear. अब आगे का पूरा अच्छे से पढ़ के विल गो फॉर द नेक्स्ट. अभी आई एम आस्किंग यू टू रीड फार्माकोलॉजी आल्सो. आई विल आस्क यू क्वेश्चंस फ्रॉम फार्माकोलॉजी नाउ. You will suggest on group what you want first, whether you want sympathetic first or parasympathetic first. तो these basics you will complete, है ना. एनाटॉमी फिजियोलॉजी का बेसिक्स पूरा करोगे, एंड आफ्टर डूइंग ऑल द बेसिक यू विल रीड फार्माकोलॉजी. ओके, एंड देन विल स्टार्ट. ठीक है. बाय टुमारो आई वांट दैट यू हैव गॉन थ्रू इट. ठीक है. आई विल आस्क द क्वेश्चन. चलो, वेरी गुड. I hope you understood. Once you understood all these basic concepts, I am very sure you will be very good in pharmacology. Okay? So take care. Be safe.